Hello, everybody. Welcome to another video. This time it's on chapter 2, and we'll cover inflammation in terms of the mediators that are involved. So mediators of inflammation, and really this is our body's form of biochemical warfare, especially when trying to eradicate pathogens that are invading our bodies. So some basic facts. Biochemical messengers will guide the course of inflammation. They are multifunctional, so they have numerous and varied effects, and it really depends on their cell and tissue targets. Also, all pro-inflammatory mediators have anti-inflammatory deactivators, and this is the way that inflammation is actually controlled and regulated. So where do these mediators come from? Well, they're primarily found in the plasma, and also they are found and released by cells. So the proteins in the plasma are synthesized by the liver. They circulate in an active form in the blood flow, in the bloodstream, and then are released when the plasma is seeping out of the blood vessels during inflammation, and then they become activated in the tissues. The mediators that are created by cells are synthesized by the leukocytes, platelets, endothelial cells, and even neurons. So the ones that are coming from the cells can either be preformed or they can be synthesized after the cell is stimulated. So if they are preformed, they will be stored in granules or storage bodies. This allows for the fastest release. These mediators are the quickest acting, and they are the shortest duration. An example would be histamine. Then with de novo synthesis, these are the ones that are synthesized after stimulation of the cell. They are released several hours to days later, and they are usually longer acting. So an example would be cytokines. Mediator types, and there are very many that we're going to be discussing. So the types and sources, the ones coming from the cells are histamine and arachidonic acid derivatives. The ones coming from the plasma are precursors of bradykinin, Hagman factor, and the complement system. And the complement is underlined because that is considered the most important of all of them. So histamine, we've already discussed histamine, so I'm just going to give a brief overview at this point in terms of key facts. So we know it's made by the cell. We've seen the granules inside the mast cells already. This is actually one of the first inflammatory mediators that is released, and that release is instantaneous. And histamine will have a variety of actions, and it really depends on the tissue and receptor type. So we have two receptors primarily. We're going to talk about the H1 and the H2. So tissue effects with H1 receptors, we get that vasodilation. That's when the smooth muscles relax around the red blood cells. And then you get hyperemia. That's when the blood starts to accumulate in the tissues. H2 receptors are associated with bronchial constriction. So here the smooth muscles contract. And a disease that that occurs from that is asthma. And then we also see increased vessel permeability. So here the endothelial cells contract, they create gaps that then allow the plasma to seep out of the vessels, and this creates edema, which is that accumulation of fluid in tissues. Antihistamines. So these are the medications that are used to treat histamine's allergic effects. So those sorts of things could be feeling itchy or having swollen eyes or other hay fever symptoms, a lot of sneezing, runny nose. So over-the-counter examples of histamines would be Sudafed, Allegra, Claritin, and all of you have probably taken one of these at some point in your lives. The mode of action is interesting because the antihistamines will bind to the same receptors that histamine does. So the antihistamine will block the ability of the histamine to attach to those receptors, therefore keeping histamine from exerting those allergic effects or inflammatory effects. And so that's how you get a reduction in those symptoms. Bradykinin. So bradykinin precursors are found in the plasma. It forms in the tissues after interacting with an activated Hageman factor, and the effects on inflammation is very similar to histamine. It's especially noted for the way it's able to increase vascular permeability. As a matter of fact, it's considered the best of all the mediators in being able to do that. But because of all the activation steps, there's definitely a slower period of onset. However, you do have that longer duration, and in this case, bradykinin is more effective than histamine. So basically, it amplifies and sustains the inflammatory response. The other thing that bradykinin does is it induces pain. The Hageman factor, also found in the plasma, inactive. So when it exits the vessels and starts interacting with the collagen, it is able to become activated. It is needed to activate bradykinin, and it is also known as clotting factor 12. So we discussed clotting factors before. There are actually 13 of them, and they are very necessary in being able to finally end up with a good, strong blood clot. So the Hageman factor is absolutely necessary for the clotting process to occur normally. So the Hageman factor also has other end products. We know about the bradykinin. In terms of the clotting role, it helps create the fibrin, which is what binds the platelets and red blood cells together, and also helps create that clot, which will contain the infection and keep the pathogens from getting into the blood vessels. And the Hageman factor is also responsible for creating plasmin, and plasmin has the opposite effect of being a clotting protein because it dissolves clots, and this is necessary to initiate and achieve healing. And plasmin also will activate other mediators. So you can see there's sort of a complicated relationship here. And this is just a chart that from your book that just shows here you have your Hageman factor, bradykinin, plasmin, and fibrin. And there's all sorts of interactions and all sorts of effects going on here. Arachidonic acid derivatives. So these are lipids. They are not proteins. All the other mediators are proteins. So being lipids, they actually are derived from the cell membrane. And you can see that in this little chart here. Here you have your bilayer membrane, and you have your phospholipid molecules where you have your phospholipid head and the tails. And the arachidonic acid is actually the tails. So that is where all of these mediators come from in this family. So only a few cells are able to produce them. And these are platelets, endothelial cells, and certain select white blood cells. It's a very large family of mediators. Almost 200 types have been identified. And it all starts when the arachidonic acid is broken off of the phospholipid layer by an enzyme called phospholipase. It is then metabolized over two main pathways, and the end products of this metabolism are multiple pro and inflammatory and clotting agents. So here is a basic chart, again from your book. It shows this process occurring. You have your white blood cell. In this case, it looks like a neutrophil, has the membrane that is going to be broken down now by the phospholipase enzymes. you get your released arachidonic acid. Then you have the two pathways of metabolism. One is called the lipoxygenase pathway. The other is called the cyclooxygenase pathway, also known as COX. So if you follow the lipogenase pathway, you end up with leukotrienes, which are very pro-inflammatory, and they are associated with asthma and anaphylaxis. And then the lipoxins, and these are associated with counteracting the effects of the leukotrienes. So these are anti-inflammatory agents. And then if you follow the COX pathway, you get to thromboxane. This again is very important mediator for clotting. Prostaglandins, these are very pro-inflammatory mediators, and they're actually associated with fever and pain. And then prostacyclins over here are the ones that will counteract the effects of the prostaglandins. So if we move on, I just went over this, so this is for your reference. You can look at these again, the two pathways and what results. And then in terms of medications, these are important anti-inflammatory medications that are used. The most important of which are the corticosteroids. So prednisone is one form. These corticosteroids knock out this enzyme and completely stop the formation of any of these arachidonic acid derivatives. None of them are produced. So in this way, you completely knock out inflammation the best that you can. The problem is that there are some very significant side effects with corticosteroids, and if you're on them for any extended period of time, you can't just stop taking them. You have to taper. So if you start with 3 tablets a day and you've been on that for a couple of days, then you'll go down to 4, and then, let's start with 6. Then you go down to 5, then you go down to 4, then you go down to 3, 1, and then none. So you have to get off of them very slowly. For the lipoxygenase pathway, here you have that asthma problem, also severe hay fever, anaphylaxis. There is a medication, it's called montelukast, also known as Singular. This medication affects the leukotrienes and will definitely dampen the symptoms that they cause. And then here on the COX pathway, notice aspirin is indicated here. So aspirin as well as NSAIDs, and NSAID stands for non-steroidal anti-inflammatory drugs. That represents Advil, Motrin, Aleve, among others. So these are able to affect all of the mediators created here along the COX pathway. Aspirin is very effective, though, in blocking the thromboxane production. So what you see here is an effect on blood clotting. So just be aware if you have a patient on long-term aspirin, when you're treating them in clinic, you may notice that there is it basically takes longer for the bleeding to stop. So blood clots can form, but it can take longer. And certainly if you see aspirin combined with any other anticoagulant like Coumadin or Xarelto, those are 2 that I'm thinking of right now, that means that there's something very significant going on with that patient, and you really need to kind of figure out what that is, or at least let your dentist know that this patient is on 2 forms of anticoagulation, and that needs to be found out why. So we went over these medications. Again, this is a good slide for your reference. So finally, we move on to the complement system. So what's very important here is that this is the only mediator that directly kills pathogens. All the other mediators do that directly by stimulating other cells to do the killing, or process of inflammation or whatever, but complement creates something that will kill the pathogens directly. So complement proteins are found in the plasma. They're called complement because they enhance the immune response. There are over 30 proteins and protein fragments that are involved, and they are numbered from C 1 to C9, and then as the enzymes get activated, they'll become C1A and B, or C3A and B. Basically, what you're dealing with is a cascade. There are many things that will activate complement. So we have the Hagman factor that does, we have bacterial surfaces, and even antibodies. And complement can also act as an opsonin. So an opsonin is a substance that coats pathogens, and this improves the recognition and ability of phagocytosis to be performed by the cells. So it's a important way that phagocytosis is improved. Here is a slide of what we call opsonization. So here you have these white spots here is actually the opsonin. So this could be complement, it could be something else, but you can see underneath it, it's a little brownish. These represent viruses. And so all of these are coated, and you can see this is a macrophage, it's much bigger. And now it's coming in to phagocytize these little viruses that have been coated and opsonized. Try to say that 10 times fast. So complement has more effects, important effects. It stimulates mast cells to release histamine. So this will initiate as well as fuel inflammation. It promotes chemotaxis, so it acts as a chemokine. It can bring additional phagocytes and other white blood cells into the inflamed area. And very importantly, it forms the membrane attack complex, also known as MAC. And this is where you get that direct killing of pathogens. So here you have a chart. You can see complements starting here at C1. There's a lot of activation and changes going on until you finally get to C8 and 9, which are involved in creating the MAC complex. And if you look back a little bit here, you can see complement is acting as an opsonin, coating the bacteria, which is now being engulfed by the leukocyte. Here it's stimulating mast cells, and you get vasodilation. Here it's acting as a chemokine, and it's calling in other white blood cells. And then, as I said, then we get that MAC molecule. So what is MAC actually? Well, as you've probably noticed, it's the endpoint of the complement cascade. It occurs when proteins C5 through 9 bind to the outer surface of the targeted membrane. And in doing that, this will form pores in the membrane. So you're going to get leakage, you're going to get water flowing into the pathogen's going to break open and die. And in releasing all of its contents, you're also going to get local tissue necrosis occurring. So here's that in diagram form. You see the C9s, how they come together, forming a circle, which actually goes through the membrane. Here you see a picture of that from an electron microscope. And then finally, this breaks everything down nicely. Complement proteins are forming on the membrane until you get the pore created. Here you have your water and other ions that are entering into the bacteria. In this case, the bacteria swells, bursts open. And this chart, you saw this before when we discussed cells of inflammation. And so you're familiar with all of these different types of cells that are present. And you can see if you follow the little dots here, what's actually going on in terms of what's being released mediator-wise. So the red dots represent inflammatory cytokines, and then all the other ones are either anti-inflammatory cytokines or mediators, I should say, cytokines and mediators, as well as growth factors, and then mediators like lipoxins are in here too. So you go from beginnings of inflammation to the peak, and then resolution through what is being released by various cell types to end inflammation and eventually get healing. And that is all. So if you have any questions about this material, get in touch with me. It's pretty straightforward. Your book is also very good in describing these mediators. So that's another reference for you. And I will be seeing you soon in class again. Have a good week.